Well, Mr. JC, my name is Justine McGurr. I'm a nursing student with South University, and I am in here to do a full head to toe assessment on you. Is that okay with you? All right. So I see here that the nurses already got your vital signs and your weight and height, so I'm gonna just review that with you. Your blood pressure was 120/78, which is good. Heart rate 75. Your temperature was 97.8, and your oxygen level was 99%. So those are all really good numbers. Your height was 5'9", weight 132, and that puts your body mass index at 19.5, which is considered a healthy weight. So keep up the good work, okay? So I'm gonna go wash my hands. Okay, and this is a well-groomed male that looks well nourished, well dressed, calm and cooperative. Um, Now we're just going to go on. No, I do not notice any lesions, bumps, bruises, or anything like that to his skin. All right, and now I'm just going to assess his head. I'm going to palpate for any lesions, bumps. Any tenderness, Mr. JC?
No.
Okay. His hair is evenly distributed. All right, we're going to look at his face here. It looks symmetrical. Now I'm going to palpate his temporal forces. And there are 2 plus bilaterally. All right. Now we're going to just move on to your cranial nerves here. First, we're going to assess cranial nerve number 5, which is the TMJ. So I'm just going to palpate. Any tenderness? And I want you to clench your teeth for me. You clenched them? All right. Any tenderness there? All right. So next we're going to assess cranial nerve number 7. I want you to smile for me. Puff your cheeks. And stick out your tongue. And what I'm doing there is I'm just noting for symmetry. All right. And then also lift your eyebrows for me. Okay. Next, I'm going to be doing what we call a sharp dual test. So I have an object and I'm just going to touch various places on your face, and I just want you to tell me if it is sharp or dull, okay? So I just want you to close your eyes for me.
Sure.
Sharp?
No.
That's okay. So sharp or dull, or dull meaning like soft, okay? So close your eyes one more time for me.
No. Sure.
That's sharp, okay. Close your eyes. Keep your eyes closed.
No. Sure.
Close your eyes.
Oh. Sure.
All right.
Oh no.
Good job.
Got me.
All right. So next we're going to move on to cranial nerve number 2, and we're going to be assessing your vision using the Snellen chart here. Let me get this set up for you. All right, Mr. JC, I want you to take your right hand and cover your right eye for me, and I want you to read off those letters there that you see.
A B C D.
All right, and I want you to do the same thing with your left hand.
A B C D.
All right, good job. Vision is 20/20. Next, we're going to be assessing your peripheral vision. So I want you to just look straight at me, and I'm just going to be moving my fingers, and I want you to point to the direction you see me moving them, okay? So keep your eyes on me, okay? Point.
Oh.
Point to it. There you go. One more time. All right. Good job. All right. We are going to move on to cranial nerve number 3. I am going to assess your pupils, your conjunctiva, iris. No abnormalities noted. Pupils are equal, round and reactive to light. Then I'm going to take my abdominal scope, and in a normal setting, I would cut the lights off and take my abdominal scope and check his red reflex. That's good. And all the vessels look good as well. All right, Mr. JC, we're gonna check your ears. Got my otoscope here. And I'm just taking a peek. Gray, pearly, patent, no drainage noted. And I would do that on the other ear as well. Then I would do the whisper test. So Mr. JC, I'm gonna have you cover this ear for me, and I'm going to whisper some numbers, and I just want you to tell me the numbers that you hear, okay?
986.
All right, we're gonna move on over to the other side. I want you to do the same thing.
253.
All right. And I am going to take my tuning fork here, and we're going to do a Weber and Rhine test. So, I'm just going to tap this, and you're going to hear vibrations. You just tell me when you stop hearing it, okay? Okay, I'll do the next. I'm going to do the same thing, but I'm going to be placing it up here. I want you to tell me which ear you hear it in the most, okay? Let me see. All right. Next, we're going to inspect the nose. Let me get on some gloves here. So I'm just inspecting bilateral ears. They are both patent. No swelling, no drainage noted there. And then I'm just going to palpate your sinuses for any tenderness. Any tenderness there? Okay. All right, so next we're going to move on to the mouth and throat. So I have my tongue depressor here. Mr. JC, I want you to just open up and say "ah" for me. Stick that tongue out. Okay. Mucosa is pink, moist. Everything looks symmetrical, no abnormalities. Uvula is midline. All right. Next, we're gonna just move to the neck. So I just want you to kind of do some range of motion here for me with your neck. Kind of look to your left, your right, up and down. Any pain there? All right. And then we're just going to assess the lymph nodes. We are assessing the preocular, postocular, occipital, submental, submandibular, tonsillar, superficial cervical, posterior cervical, and supracervical. And then I'm just going to assess the thyroid here. So midline, no nodules, masses noted. Okay. I'm going to move on down to your shoulders. I want you to just kind of shrug your shoulders for me. All right. No pain, no bruising, no bumps there. All right. And then we will inspect your elbows here for any knots, bruises, lesions. All right. I want you to do some range of motion for me with your arms. Just kind of, there you go. Any pain? All right. We are going to check your brachial and radial pulses. All right, and they are 2+ bilaterally. All right, I'm gonna kind of do a strength test here. I want you to kind of pull back on my hands towards you. Pull back on. There you go. Good. You are very strong, young man. And then I want you to push towards me. Oh, okay. Good job. All right. Next, we're gonna move down to the chest, and in a normal setting, I would have the shirt would be off. I would inspect for any lesions, bruising, knots, any masses. Okay. Next, I'm going to palpate your carotid pulses bilaterally. All right, and then we're going to just take a listen to them as well. No bruise noted. Next, we're just going to take a listen. We're listening at the aortic, pulmonic, tricuspid, and the mitral. Heart rate and rhythm is regular, no murmurs noted. Moving on to your lungs. Just take a deep breath for me. Lean up a little for me. Just take some deep breaths. We're gonna auscultate the lungs. Lungs clear in all lobes. All right, feeling that form, we're just going to palpate. Any pain? And percuss in 6 areas. Any pain? All right, Mr. JC. So for the next part, I will need you to kind of lay down for me. We're going to be taking a look at your tummy. And I would inspect for any lesions, bruises, masses, or anything before I percuss or palpate or anything like that. Then I'm going to auscultate all 4 vowel sounds. Vowel sounds are present in all 4 quads. Then we're going to listen for the aorta artery. Iliac. And femoral. And we're listening to see if we hear any bruise, which I did not. And I would use the bell of my stethoscope to do that here. We're gonna cuss Palpate. Any pain? Any tenderness? No masses noted. Then we check for rebound tenderness is I'm going to press and release to see if there's any pain upon releasing, and no pain noted there. All right, and then I would have you turn on your side for me if you can. That way. Oh, there you go. And we're gonna bend this leg here back. No, on the like. There you go. Any pain there? Okay. And then I'm gonna have you lay back on your back for me. All right. So what I need you to do here is bend your knee at a 90-degree angle, and we're gonna tilt it, rotate the thigh outwards. Any pain there? No? Okay, and both of these tests is just assessing to make sure there's no tenderness or pain in the appendix area there. All right, Mr. JC, you can sit up. You got it? Need to sit? You just made that for me. All right. Well, while he was laying down, I would palpate and percuss the bladder for any tenderness or abnormalities there. Also, if you kind of turn that way for me, Mr. JC, I'm going to search for CVA tenderness. Turn your whole body for me towards the wall. Any pain? All right. I can turn back for me. So that there's just checking to see if he would have any kidney infection there. All right. Moving on down to the lower extremities, I would inspect these as well for any lesions, bruises, abnormalities. All right. We're going to palpate two forces bilaterally. We'll palpate the dorsalis pedis bilaterally, and then the tibial bilaterally, and they're all 2 plus equal. Stand up for me. All right, we're just going to do some hip and knee range of motion, just kind of rotate. There you go. Do it on both sides. And what? Knee. Bend your knee. All right. Any pain? We're just checking your range of motion in your lower extremities there. All right. And kind of sway your hips for me. All right. And then back and forth. Okay. Bend over for me. I'm going to check your spine there. Okay. And just stand there for a second. I'm going to check your balance. All right, close your eyes for me and just stand still. I just want to check your balance. Make sure I don't see any swaying. Okay. You can sit down for me. I'm going to do the sharp jaw test on your lower extremities as well. And you just kind of tell me if it's sharp or dull.
Short. Short. Short.
Okay. Good job. No, that's normal. All right, we're just going to test your coordination. If you can just take your left hand.
All right.
Mm-hmm. Right. Okay. And what I want you to do now is I want you to take your right heel and I want you to rub it down your shin. And I want you to do the opposite. And that's just checking your coordination there, which everything looks good. Everything looks normal. All right, Mr. JC. Now I just want to do a gait test on you. If you'll stand up for me and kind of turn towards the wall there. And what I want you to do is slowly walk towards the wall with your feet heel to toe. And I'm just taking your balance. Alrighty, you can turn around and do it back. Okay, good job. Good job. Good job. All right. Last but not least, we're going to check your thick tendon reflexes, okay? So I got my hammer here. We're going to check your bicep reflexes. Just relax for me. Okay. Okay. Your triceps. I want you to lift your arm for me and kind of let it lean there, hang. Okay. Okay. And your brachial radialis. All right. Reflexes are looking good in the upper extremities. Now let's do your lower extremities here. Tiller. Okay. And I'm going to do the Achilles. And this is just checking the ankle reflexes down at the bottom there. We would do that bilaterally. And get my little tester here and do the Babinski sign at the bottom of the foot. Good job. One more time. All right. So all of your reflexes are normal. All right, Mr. Jesse, do you have any questions or concerns for me? All right. Thank you so much for your time. Let's see.